in the heart of Yorkshire.
Red phone.
Hello, Barnsley A&E.
An unbeatable team.
1, 2, 3.
Hard at work 24 hours a day.
I feel like I'm on Titanic and bows just lifting up out at water.
7 days a week. Saving lives.
Hands across your chest, Mary. We've got you,
Helping loved ones.
Well, I'll be looking beautiful again.
Didn't expect to be losing part of my body today.
Making the community they serve better.
I thought I'd do it up. Oh, you're okay.
All staff's been brilliant.
A health service treating anyone
You'll need to see a doctor.
You'll find out that I'm an idiot.
and everyone. A team doing anything and everything for each other.
Sweetheart. Hey.
This is Barnsley Casualty 24/7.
The National Health Service might not be perfect, but thank God we've got it.
Another life saved.
On shift tonight. Emergency nurse practitioner Joe.
Is it still hurting now? Keep going on that then. Stops working. Go on, keep going on it.
Dr. Phil Taylor.
I hear you've got 17 Jack Russells. What's feeding time like?
Well, about.
And
Cooey.
volunteer Jane.
So that's taking it to a new level now, actually feeding her.
So, get ready to share a shift
This is not really professional,
with the team at Barnsley Casualty.
but it's chocolate. It makes it all right. Can you see if you can find a wheelchair for Christina, please?
It's the first shift of the week at Barnsley Casualty.
It's very, very busy. It's been a really busy morning. 73 patients when I took over an hour or so ago.
It's a shift where Sister Joe knows exactly what to expect.
It seems to be like obstacles at every... You've no beds, so that's an obstacle. Then you've got beds and you've no porters, so that's another obstacle. It's a bit of a mess, to be honest.
It's one so busy,
Mondays are always horrendous.
it's even got its own nickname.
We call them Manic Mondays.
Mondays are always busier.
Mondays are terrible.
So on Manic Mondays, you get an influx of patients. People have been waiting for the whole weekend to see a doctor. We get a rush of people coming in and things can get really busy, waiting times can get really long and it can get a bit chaotic.
We've now got 82 in the department, so that's not... It's not the way we want it to go. So we're looking towards another 100 Monday, I think, looking at it. We're 108 last week, so it's going to be the same. It'll top 100 before we've finished.
Manic Monday is already living up to its name because
Oh, gosh.
a critically ill patient is on his way.
Hello, Banzani.
Paramedics are blue lighting in a 66-year-old with a dangerously high heart rate. Dr. Jake Mullen heads to Resus to prep for Howard's arrival.
I love working in resus because I'm looking after the most unwell patients and it's where I feel I can make the biggest difference.
So he's gone to see his GP today because over the weekend he's been increasingly short of breath and dizzy. They've done an ECG today to find him in fast AF.
Yep.
It's not known AF as of yet.
Okay. All right, thank you very much.
No worries.
Cheers. Have you ever had any problems with your heart before?
No.
Dr. Mullen has the charts from the paramedics, and it's not good reading.
Each one of these big bumps each time his heart beats. There's also quite a lot of those bumps as well, which means it's going quite fast. So normal heart rate varies depending on family factors, but also how athletic you are. Average is about 70, and we'll accept anything sort of 90 to 100 really. So his is beating at 150 beats per minute, which is really quite fast. So we need to get on top of it quickly.
But now another poorly patient is heading to resus. 74-year-old Elvin is suffering from the opposite condition to Howard, but it's just as dangerous.
Right then, sir. My name's Phil. I'm one of the doctors.
Yeah.
So what's been going on with you today?
Pressure across here, pressure across my chest, and a funny sensation at this side here. And like I'd get lightheaded and start, you know, I'd want to sit back down, lay down. I don't feel right.
Okay, don't feel yourself.
No.
All right.
No.
Did you say you've been feeling breathless as well?
Yeah.
Okay. It looks like from the heart tracings that we've got that your heart's going a little bit slowly.
Yeah.
Which shows why you've been feeling breathless, because the heart's not pumping quickly enough to get enough oxygen around the body, so it's making you feel dizzy, breathless, and a bit of kind of aching of the chest.
Yeah.
All right? Right then. His heart rate is about 36 beats per minute. Usually someone's resting heart rate would be between 70 and 100. If someone's heart rate is beating very slowly, then there's not enough blood getting to their brain, and consequently not enough oxygen getting to their brain. So this is a potentially unstable situation. Gonna get a cannula in you.
Yeah.
All right, and get some blood tests. But I think all these symptoms are because the heart's going a little bit slowly.
Aye.
A resus this busy is the last thing Sister Joe needs today.
It's just like, oh, right, my nurse. Let me get this patient off here.
Definitely a Monday. The people are queuing out of the door. What can we do?
Back in resus, it's too dangerous for Howard to go to radiology.
2013.
Hello, what name is it?
So they come to him.
Step forward for me, darling. Okay, breathe in for me now. Hold your breath. Breathe normally.
Dr. Mullen orders some emergency medicine too.
Hello, darling.
Hello.
So if you have a little sip, and then I want you to take these tablets.
But if that doesn't work, he may have to start prepping Howard for surgery.
We really need to just focus on getting that heart rate down as quick as possible.
A full resus and packed waiting rooms. The pressure is starting to get to Sister Joe.
Okay, let me just have a meltdown. I'm really fed up. Lena, Lois, 8's free.
It's Monday morning at Barnsley Casualty,
8's not free.
I've just asked them and they said it is.
and Sister Joe is struggling.
It's not free.
Who says? I've just asked Hayley and she said yeah.
So far, nothing is going to plan.
Hang fire. Marie's ain't not free. Every day is so different. Yeah, you get your chest pains, yeah, you get your difficulty breathings, but you don't get the same patients. Every day brings a different challenge.
Manic Monday is probably people who've kept their illnesses over the weekend and everyone decides to come on Monday about it.
They do tend to be busy and they can be quite stressful.
You know, family and friends will say to me, oh, I bet Friday night and Saturday night are terrible. Mondays are the worst.
Well, it's not free then, Lena.
Over in Miners, a 35-year-old roofer has had a bad start to his week too.
Dale, do you want to come in? We'll get you sorted.
Father of 4, Dale, has had an accident at work.
Hello, have a seat on this chair for me. Just tell me what's been happening this morning.
Well, I've gone to work this morning. Got to the job about, I think it was 8:30, 8:45. I've started taking roof off. Fell forward. I've just fell straight through the roof, basically,
Okay.
and straight onto the floor.
Right, what job do you do?
I'm a roofer.
Right, I'm just going to have a look at this wrist first. Any pain up here?
No, it's just... Oh, they had a bit... Yeah.
What about up here?
I'm all right on my shoulder. It's
Yeah.
more or less all that arm. Probably.
Can you move your fingers for me?
Ah.
Can you move them at all?
No, that's such struggle I'm having.
Dale looks like he's in pain. He's got a obviously deformed wrist that looks misshapen, doesn't look like it should.
I'm going to get you something that you can breathe in and it'll be instantaneously take pain away for you. Right, I'll sit you on here first.
Right.
I mean, you feel all right. Some people, it makes them feel a little bit woozy, you know, just like you've had a pint or something. Or a couple of pints. Well, we'll see.
Yeah.
The minors department sees a lot of workplace injuries.
If you've just a moment's lack of concentration and you can do some serious damage.
And the emergency nurse practitioner knows the importance of getting them back to work quickly.
So big, deep breaths in and out, OK? I want you to do about 20, just as really suck it into your lungs, and then it'll start to work.
We need to get him sorted.
Jesus.
You all right?
Yeah. Strong. Whatever it is. Ow.
Waiting for a porter today is going to take too long. So she takes Dale straight to radiology herself.
Stake my salary on the fact that it's going to be broken, could you?
Wow.
So this is our X-ray. All right, I'll see you in a minute.
Yeah, thank you, love.
Dale's looking at weeks off work already, but a bad break could mean months. Another Monday morning emergency is on its way. A patient with a history of abdominal pain has had a relapse. Catherine's husband Kevin came with her. And consultant Dr. Laura Buxton is on duty today.
The nurses are just getting some pain relief out for you now, OK? Have you been vomiting, Catherine?
She was a little bit this morning, but more phlegm.
And how long ago is it since you came in with this presentation before?
Might have been 3 months, 4 months.
OK.
Came to this hospital.
And what did they do to sort it out?
I see patients at probably one of the most vulnerable times in their lives, and it's absolutely brilliant for us as health professionals to have their closest relative with them, to support them, to be their advocate, to ask questions on their behalf.
It does look exactly the same symptoms. I'm not saying it is, but...
Well, we'll get this cannula in, get some pain relief on board, and some anti-sickness.
But having a relative in the room is good for the patient, as well as the doctor.
It would be unusual for any human being not to want their nearest and dearest with them, to help share the burden, to help support them.
You all right? Catherine? Yeah?
Catherine suffers from ulcerative colitis, a painful condition that regularly causes her abdomen to flare up.
Yeah. That's all done, sweetheart, all right? Get those bloods checked for you.
But it's the potential impact the inflammation can have on her other organs that is of most concern to Dr. Buxton.
Is that cool, eh? Hey, Catherine?
If the treatment is too late, Catherine could require emergency surgery. Mondays might be manic here in Barnsley Casualty. But volunteer Jane has just clocked on to offer a helping hand.
Can be really busy on a Monday. Sometimes Monday you'll get people that's had accidents on a weekend and they've not realised that they've had an accident. And then they'll wait while Monday morning while they wake up and then think, do you know, my ankle hurts me or whatever because I shouldn't have jumped on that trampoline when I've got 6 pints down me.
But now this Manic Monday has just taken another turn for the worst.
It's really, really serious when the sweet drawer is empty. Because that's, well, we need a Cobra meeting for that when the sweet drawer's empty.
Good job that even when she's on her jollies, volunteer Jane is still thinking of the staff.
Right, I've got some sweeties here because I've been on holiday. Right?
Yeah.
Right, I've got to share these sweeties out, you see now. As volunteers, we're here to help patients and staff. I want another dish. I want another dish. Is there any dishes in here? Because sometimes staff don't get a drink, they don't got nothing to eat.
Oh, thank you.
Dear.
Darling, would you like one?
Are you sure? And let's face it, if they're not firing on all cylinders, they can't do their job, can they?
Oh.
So that's taking it to a new limit now, into a new level now, actually feeding her. Would you like one, darling? Yes.
Back in resus, Howard's heart rate is still not coming down.
So, Howard, your bloods have come back. I've got no signs at all of any infection, which is bringing me towards the fact I think this is primarily a problem with your heart. So, I think the plan is to keep you in hospital, give you medications to help slow your heart down. Probably have to start you on some blood thinners as well. And then over the next day or two, hopefully they can slow your heart down and come up with a bit more of a plan. Is that okay?
Yeah.
Good stuff.
Despite leaving it to the Monday to get help, Howard did the right thing in the end.
Do tend to put things off when it comes to doctors normally, but someone told me to, to get phoned up and get sorted.
He needed a week up on the ward.
Thank you very much.
And was given new medication that will hopefully mean he'll avoid a return trip anytime soon. Still in resus.
Ever had a heart attack?
No.
Ever had a stroke?
No.
And any epilepsy or anything?
Oh, no, nothing out there.
Good stuff.
Elvin came in suffering from a dangerously low heart rate.
So this chap's heart rate at the moment is 37. Anything less than 60 would be considered bradycardic. So because it's beating quite slowly, he's not getting enough blood around his body to his brain. So we'll just send these other bloods off. I'm going to do a few markers for the heart, troponin, look at whether he's had a heart attack, look at whether he's got any infection on board, and then we'll get him a chest x-ray and see what's going on.
Elvin had been ignoring his symptoms all weekend. That is, until his daughter Jade found out.
So my daughter's been firm with me and made me come. She just nags and nags and nags.
Well, they wouldn't let me bring him in last night, so I told him that he got to ring the doctors first thing this morning, and they said he got to come straight to A&E, so I've brought him straight here. But I just wish he'd slow down, because he don't listen to anybody.
But slowing down is not an option at the moment. Elvin is a dog breeder and has 17 show dogs to keep in tip-top condition.
I go all over, North Yorkshire, Derbyshire, Leicestershire. And like I say, I competed at Great Yorkshire Show on Thursday, and I won. I have Jack Russell, real Jack Russells, the genuine Jack Russell. And I got first with my rough-coated bitch, first with my smooth-coated, and I ended up with a champion and reserve champion, Jack Russell. I've won 99 prizes. So I'm having a good year.
I keep telling him if anything happens to him, because of these dogs, I'll never forgive myself. And he doesn't realise that it's impacting his health. And he lives on his own, so it's quite worrying, really.
I just like to get on with things. If somebody says it can't be done, I say it can. It's happened a little bit harder.
The radiographers arrive. Elvin is hoping it doesn't show up anything that will keep him away from his dogs for too long.
Are you busy?
Back in the hub,
Christina, do you want to go with that one then, HD1, because it's got a new as a 7, yeah? Perfect.
Sister Joe's Manic Monday shift is living up to its nickname.
Would you take this lady round to CT when you've done her obs, please? Would you take her up to the ward, please? You what, love? The numbers are still going up, so in the last hour and a half we've gone up by about 20. So we've got rid of 4 and got another 20, so that don't add up.
Over in radiology,
The floating.
father of 4 Dale has been given pain relief to help cope with the pain from his fall at work.
Pain just eases, but it doesn't actually go, but you feel like you're on a little cloud.
Hello, Dale. So we're just gonna take a picture of your wrist first, okay?
We're flying on space.
Seems to be quite happy with himself, doesn't he?
X-ray complete.
Makes you want to fly to that moon, doesn't it? Though?
Fly to the moon. Right.
So flying swing.
Pain relief has kicked in.
It blocks pain receptors, so it's an inhaled drug. And what it does is make people a little bit more relaxed.
That feels nice. It really feels nice. But I can still feel my arm a bit. Yeah.
It does tend to heighten people's personality or makes them a bit like they've had a drink or some substance.
La, la, la.
Dale, are you back? I can see Penthrox has kicked in.
You can see me need some back from too, yeah?
That's not the reason we use it, but it does add to the fun of the job.
I need a drink.
You can have a sip of water if you want a sip of water, do you?
Oh, can I have no lager?
This is an hospital. It's not Wetherspoons. Right, so this is your wrist. It's broke all the way across there. You see, so that's your radius. So it's this one, isn't it? So across here, it's broken here. Right? I need to give it a bit of a pull to get into a better position, okay?
It might not be top of Dale's mind at the moment, but the nurse practitioner knows how important it is to get this injury fixed first time.
You're not going to be working for a bit, are you?
Oh?
Because you've got a pot on, a broken arm that's going to need to get fixed.
Most people who are in a trade need to earn that money, and if they're not working, they're not getting paid in some cases. So we do have to consider that and think to try and get things fixed to enable them to get back to work as soon as possible, really.
It's like out to work and stuff like that for a few weeks and let home a bit now because I've got kids and stuff to watch and run after and because they're quite young and just have to hope for the best. I've had to have an operation, I really don't. It's the last thing I want to do, operation.
There's a patient that's been waiting on that back corridor in ISIS quarters.
It's Monday in Barnsley Casualty, and as usual, it's a manic one.
Done so much for her.
Yeah.
She's been waiting there since 3:15 for a quarter.
So the phoned one.
The department is full of patients, but now Sister Jo is having to cope with a shortage of porters.
Basically, they've pulled a load of beds from on the wards, so now we need to get them up there. But obviously, we're struggling with portering to get them up there. So we're blocked at the front door with ambulances because we're blocked here. If we could just get them moved, it'd make a bit more flow and everything would be a lot smoother.
Yesterday it was busy, but not like this. Like Mondays are always busy. Always. I don't know why people wait to come on. I won't come at all. Like I would not come to get me. I'd come if my leg was up, but that would be it.
What's your bunny called? Oh, that's a cute name.
Over in the paediatric department,
Everything blew up on me.
Well, because your eyes stuck together.
8-year-old Elizabeth was rushing to get ready for school on a Monday morning.
I picked up the nail glue instead of the eye drops and I didn't look and I just put it in.
I thought it was eye drops.
We'll read the bottle next time, won't we?
But she's ended up having to be rushed into Casualty by her mum, Holly.
Stupid but easy mistake to make. And I think it's made her eye a little bit sore. And she can have a nail glue back.
Paediatric specialist advanced nurse practitioner Liam is on duty today.
Hello.
Hello there. What's your name?
Elizabeth.
And who's this lady that you're with?
My mum.
Your mummy. Fantastic. When I pick up a patient's card and you see eye injury, and inside your head, as a practitioner, you're immediately thinking it could be a penetrating eye injury, and it could be the fact that they've had some serious trauma to it. Is it stinging at the moment, or has it stopped stinging?
It still stings.
It still stings. Can I take a look at your eye then? Oh, okay. I'm really sorry. I'm trying not to, force it open.
Treating eye injuries can be particularly tricky.
Just relax your head back. Can you open up your eyes for me?
But it's not just the patients who are suffering.
I've never been a big fan of eyes.
I can do most things as a nurse. Nothing bothers me. But eyeballs, I'm squeamish about eyeballs.
That's okay.
Me and two other colleagues that if plenty of eyes come in, they see the eyes, and if plenty of wounds come in, we see the wounds.
Watching people squirm and squint as you put drops in.
It makes me cringe. I can't do it.
I will gladly swap a wound for an eye.
No matter how many times I do that, it still makes me cringe inside.
We all have our strengths and weaknesses.
Just a horrible thing to be faffing around with.
I can do vomit, but don't show me an eyeball.
Back in Paediatric Cubicle 8, advanced nurse practitioner Liam is struggling to see how much damage the nail glue might have done.
So I think that what we need to do, okay, is we need to give that a bit of a proper sort of wash out, okay, to try and help to ease that eye open. When that eye is a little bit more sort of open, I can then take a look at it better because I need to check whether or not it's caused a bit of irritation there. There's lots of different things that can happen with sort of glue in the eye itself. It can literally be to the point of requiring surgery to open those eyelids again.
Over in Rhesus, dog breeder Elvin is being treated for his dangerously low heart rate.
So, your blood tests are fine. Your chest x-ray looks a little bit hazy on the right side. Could just be artifact from the way the image has been taken. It could be that you've got a little bit of fluid on your lungs because the heart's pumping a bit more slowly. So the plan is going to be we're going to get you to the acute medical unit, and then I imagine either later today or tomorrow they'll get the cardiologist to come and review you. How does that sound?
Okay, yeah.
I hear you've got 17 Jack Russells. The doctor who told...
We've let 5 go.
Yeah. What's feeding time like?
Well, they bark. They know when it's feeding time, you're excited when your dinner's coming, aren't you?
Certainly am. Certainly am. All righty, well, fancy that. Yeah, I think it's probably advisable to just rein it in a bit.
Slow down a bit.
Yeah. Look after yourself as well as the dogs. Okay. All righty, no questions then?
No.
All right.
Yeah.
All right, take care.
Thank you.
All the best.
Although Elvin doesn't seem to have taken on board Dr. Taylor's advice.
But can't wait to get back to those dogs. They'll be missing me.
Daughter Jade is now on a mission.
I'm proud of him for doing it, but I think it's time he called it a day now. He's always said he wants to breed a champion, and he's done it, so I think it's time to give up now and concentrate on himself.
Elvin ended up getting a pacemaker fitted to keep his heart rate in check.
Right, see you, bye.
A good outcome for his daughter and his dogs.
Well, I ain't got 3 on board. I've only got 2.
Back in the hub,
Okay. Should I have 3? Should I have 3?
Sister Jo is trying to sort out the shortage of porters.
Somebody will be coming down later, will there? Possibly. Is that a yeah or a no? Oh, all right then. All right, babe.
Her Monday is not getting any better.
We've only got 2 porters. Apparently. So yeah, it takes a bit to get me ratty, but that's annoyed me.
Over in Miners, emergency nurse practitioner Jo is hoping she can manipulate Dale's broken wrist back into place.
Right, what I want you to do now, if you can, is pop your arm onto here for me. Take some breaths on this. Take some breaths on. Try and keep your arm nice and still for me. You concentrate on that, relax and keep breathing on that. Sorry. Sorry, you keep breathing. Keep breathing for me.
Most injuries in miners can be treated by the one practitioner on duty, but not this one.
It's quite a tricky thing to do. It's a 3-man job. 1 pulls, 2 pull either way, and then somebody has to put a pot on. So sometimes they're all very different, so sometimes we get good results from them. But it is a difficult job to do. You might feel us pulling, but you shouldn't feel any pain. If you get too much pain, we'll wait while you've got some more of that. But I have put some local in here, so hopefully you relax back and think of something nice and keep taking some breaths on this for me. You just pull against me. We're just going to get some length first of all. That's it, you're doing well. You all right? Is it still hurting now? Yeah. Keep going on that then.
It stops working. Go on, keep going on it.
Keep going, it'll soon be over.
The medic's attempts to avoid an operation doesn't seem to be working.
I can't.
You can, it's done. It's done now. It's done. It's done.
And neither is the pain relief.
Dale, keep going on this. This is going to help you. Get some nice breaths on it.
I'm trying my best.
That's when you start.
It's killing.
Just keep going.
Dale might need emergency surgery after all.
Last bit.
And have a big breath on it. Cover it up with your finger there. Now, there.
Over in radiology, Catherine's having an urgent X-ray on her abdomen.
You take a deep breath in for me. Hold your breath. Breathe normally.
Husband Kevin anxiously awaits the results.
Well, it's knocked me back a little bit, but we're used to it. She's been in hospital a lot of times before, but I thought this was a little bit more serious than normal, this one. And it was just, but they're fantastic here, I must admit. Anyway, I get a bit upset about it, so.
Yeah, I don't know where our daughter said I don't know where I'd do without him. He's looked after me for just when I first got poorly 15 years or so. Yeah, I've got a good one there.
The X-ray results are back, and so is Catherine.
All right. Yeah.
Surgical registrar Mr. Ahmad has taken over her care.
Right. Surgical team is here.
Right.
Hello, it is Catherine.
Yes, it is.
I have looked at your X-ray. They're not indicating any major condition. So how is your pain now since you're in the hospital?
Since I had the morphine.
Yeah, you're feeling a bit better? So what we can do, we can keep you for 1 night to observe in the hospital. Yeah, we'll give you some fluids, some pain medicines. You can have free fluids now. Okay, you don't need any emergency surgery or any operation at the moment. And if you remain well, we might send you home tomorrow.
Okay.
Good news for Catherine.
Okay, thank you.
Thank you.
Cheers, thank you.
Thank you.
Thank you.
In the end, she only had to spend the 1 night up on the ward. Catherine's now free from pain again and back home with Kevin. Over in paediatrics, Elizabeth has accidentally used nail glue instead of eye drops.
Take your hands off your eyes because you're going to rub it even more.
Advanced nurse practitioner Liam needs to check the chemical protocol to get her eyelid back open.
So I've just searched for the nail glue. There is only one main thing for nail glue. That's part of why I really enjoy my job, is because you might have, you know, a kid that comes through the door with glue in their eye, or it could be that sort of like really nasty trauma to the eye that you then really need to think out of the box of what we're going to do and where we're going to send the patient.
It was pollen in the air that initially caused Elizabeth's eyes to itch. But after the mix-up, the air was filled with something else.
When I said it stinks, she looked at the bottle and she swore.
Giving away all my secrets there, Elizabeth.
Armed with the correct information, Nurse Alicia carries out the first phase of treatment.
You don't need to be scared. You're a brave girl.
Do you want to just give me a cuddle while you're doing it? I'll hold your hand. How do you want?
Do you want me to hold your hand while you're doing it?
A whole litre of saline needs to be flushed through Elizabeth's eyelid.
Yeah, it's not going to hurt you, I promise. And if you do want to stop, yeah, you let me know and we'll stop. Okay?
Only then will the medics be able to assess how much damage has been done to the eye itself.
You ready? Ready to start? Stop. Stop. We are going to have to get all of this water through your eye, darling. Okay. Well done, you've been so brave. Get all this glue out. You're doing good, baby. Nearly done. We're down to the last little drops now.
Phase 1 is complete.
Give it a bit of a wipe. We'll let Mummy do it.
It's a bit blurry.
Right, it will be a bit blurry. Look like you've been in a fight.
But will the nail glue have done any lasting damage to Elizabeth's eye?
Good girl.
So there's only you and Lean around here until Jane comes back in there. Is that right? Okay. Need to nick somebody.
It's a typically manic Monday shift in Barnsley Casualty.
Will you put that in his notes, please? From stroke nurse. Thank you.
And there's only one way Sister Jo is getting through it.
Chocolate. Plenty of chocolate now. We shouldn't do this. This is not really professional, but it's chocolate. It makes it all right. You can keep your cups of tea and your cups of coffee, but if you just feed me chocolate, then I'll get through. That patient's going now with Ristina, put Andy's there. So as soon as that patient goes, you can have that one.
That's it.
Pushing me.
I know, we just need to hold it there till we get pot on. And it's done. It's done. I know. I'm sorry.
Over in Miners, Dale's broken wrist has been pulled back into the right position.
All done. Now you've got to keep your fingers crossed, or I have.
Ball on top of it. So now I can move my fingers a bit now. Compared to one, just couldn't move them at all. Now I can feel them.
The medical priority was Dale's wrist. Now emergency nurse practitioner Jo can close up the deep gash on his leg.
So, we're going to put some local anaesthetic in this, and then we're going to put some stitches on in for you. Okay?
My family and friends would laugh because I'm not a sewer. Rubbish at sewing. Not something I've ever been good at.
Can you sew, Dale? It's gone.
But I can stitch, I can sew skin, and I take pride in that, and I would say I'm quite good at that. But no, I can't even sew a button on.
We practice on things like chicken, because skin of chicken is a bit like skin, so we taught on things like that. Nearly done.
Can't you remember going to drop it off?
No?
Do you were pulling it, that's it.
Yeah. Are you okay now? A total of 10 stitches there
Yeah.
that you've managed to sleep through, so that were good.
All stitched up, Dale now needs a second X-ray on his wrist to discover whether he'll have avoided surgery. Over in paediatrics, Elizabeth and her mum Holly are about to find out if the nail glue has caused any permanent damage to her eye.
Very guilty. and quite stupid.
I feel stupid, I read it.
Daft that I didn't pick the bottle up and actually read what I was doing, and I just took a 8-year-old's say-so on it, but accidents happen.
Parents will inevitably feel guilty, but part of our job is to provide that reassurance that accidents do happen. We can provide safety advice for them going forward from that point. Hello there.
Hi.
How did that go?
Good.
She was fine.
Did it go okay?
Yeah, you're going to jump back.
Can I pop another drop inside your eye? Okay.
Okay.
That drop will make your eye go a little bit orange, so it'll make your sort of vision go orange.
Yeah,
It's
to match
already
Mummy's
yellow.
hair. Yeah.
Okay, I'm going to make it all nice and dark in here.
Mm.
So make it go all nice and dark. Then I'm just going to gently open your eye. Can you look down for me? Then can you look up for me?
This side hurt the most to look at.
It can make your eye look a bit bright as well when I switch this light back on, or when you're in the sun. Okay, so I don't think that you've damaged your eye in any way. Okay, eventually it will just open after like 3 to 4 days. High five. Boom, all done.
A lucky escape for Elizabeth. And a relief for her mum.
I think I'm going to leave this one down for a while. Thank you. See you.
The eyelid opened up properly the next day, and the nail glue is now being kept well apart from the eye drops. Heading to radiology is Dale.
So if you just go down there and turn right, there's a little window. Give your name in at that window again, because I'm just going to go request it. Tell him I haven't requested it yet.
He's having a second X-ray on his wrist, which will determine how quickly he'll be able to go back to work.
That's the risk with any kind of break. He might need to have surgical intervention, but hopefully not. I'll keep my fingers crossed that we've got it into a better position today. We've definitely tried our best, so we'll see.
All finished, Dale. Well done. All right.
The results come back immediately.
Come on in. So it is good news. It's in a much better position, and I'm happy with that, and hopefully that you won't need to have surgery. So I'm just going to refer you, let you go home, and we'll refer you to a fracture clinic. Thanks for being a very fun patient this morning.
Yeah, okay.
There's always that small chance that you might still need surgery, but that is a better position, so you'll find out in a few days if you need surgery or not.
All done.
Hopefully, good. Fingers crossed. Never fall for a roof again. Well, hopefully.
When Dale was seen by the fracture clinic team, they told him he didn't need surgery. Today's treatment meant he only needed to have 1 week off work.
See you later.
All right, love.
It's finally time for Sister Jo to head home.
It's been a really hard shift. It's been really busy. It's been really hot. Lots of issues with portering, getting patients up to the ward. So it's been a challenge, to be fair, this afternoon.
She's worked hard to make sure her Manic Monday hasn't created a tricky Tuesday for the team taking over.
Last Monday we had 108. We've got 80 tonight, so that's a plus point.
Sister Jo knows that Casualty can be busy anytime.
It's going to be nice at weekend again, isn't it?
Is it?
Yeah.
But at least the next Manic Monday is a whole week away.
Commander Dalgleish, Scotland Yard. This is now a murder investigation. I'm going to ask you some questions. I do expect honesty when I speak to you. No more lies. How did you kill her?
Detective Adam Dalgleish is back. Catch the new series starting Thursday at 9. Next up, it's the Motorway Cops.
Which is
life still beating in these crumbling walls. Tonight we sing where nobody sees. In the junkyard we are free. Underneath the moon silver haze, we'll embrace these throwaway days. Lost souls and cobbled parts, create art with our mended hearts. Every scratch has a story to tell, in this haven of heaven and hell. Old guitars strum a haunting tune, underneath the pale forgotten moon. Oil-stained fingers dance in grace, finding rhythm in a discarded place. Tonight we sing where nobody sees. In the junkyard we are free. Underneath